Good day, especially to our beloved clinical instructor, Mrs. Dorotaya Arosena. Good day, ma'am. Please allow me to introduce myself. I'm Sarah Mason de Cruz Silvestre, BSN2-1. So this video will be a demonstration about administering an intradermal injection for the skin test. So first, we will need to know what is the purpose. The purpose of skin sensitivity test is to determine whether a patient has a detectable IgE antibodies to a specific allergens. The skin sensitivity test have two results. We have the negative and a positive results. The skin sensitivity test have considered a positive if there is a wheal response with a mean diameter of 3 mm or greater. The larger the wheal, the more likely it is that the patient will develop symptoms on exposure to the allergens. However, there is no correlation with the clinical severity. A negative test, which is a 0 mm wheal, virtually includes that the allergen as a cause of allergy. So now we will move on administering an intradermal injection for the skin test procedures. So now, here's are the procedures that we need to do. The first step, assess the patient. We need to look the following. The first is appearance of injection site, specific drug action, and expected response. The client knowledge of drug action and as well as the response. The second step, assemble the equipment and supplies. The materials needed for this intradermal injection for skin test are 1 cc or cubic centimeter of tuberculin syringe, 26 gauge needle, cotton balls and alcohol with 70% solution, 1 pair of clean surgical gloves, sterile or distilled water for injection, and the third step, check the medication card. Because each patient has its own medication card, so we will check the label on the medication carefully. Read the label on the medication. And we need to follow the 3 checks to administer the medication. The first one, check it is taken from the medication card. Number 2, before withdrawing the medication card. And number 3, and at last, after withdrawing the medication card. So the fourth step, prepare the medication for drug withdrawal. Check for the expiration date and the manufacturer date. And for the fifth steps, prepare for the clients and provides for clients' privacy. The sixth steps, explain the procedures that the medication will produce a small wear or bled. It usually looks like a wheel on his forearm. So, it looks like this. So, sir, kapag po nag-administer tayo sa inyo ng skin sensitivity test, ito po ay ibig sabihin na itetest po natin kung kayo po ay allergy. At kung saan meron po itong dalawang resulta. Kung kayo po ay positibo o negatibo. Kapag po positibo, ito po ay magre-react doon po sa binilugan nating test dito po sa inyong forearm. Yung bilog po na yon na nilagyan po natin ng marka, mag-outside po siya doon sa binilugan natin na yun or lalagpas po siya doon. Kapag po lumagpas po siya doon sa binilugan natin, iyon po ay positibong result o resulta. Pero kapag po yung lumabas or hindi po siya nag-outside of the circle or dun sa nag-remains pa rin siya or walang reaction na naganap, yun po ay negative result or negatibong result. So, ayun po ay gagawin nating procedure. 7 steps, select and clean the site in where we administer the injection. In selecting the site, avoid using sites that are tender, inflamed, or swollen and have lesion. Put a pair of clean gloves, and remember, the most suggested part of administering intradermal injection for skin sensitivity test is in the forearm. here, forearm, and about 4 finger widths below the AC. So here, and put it here. So we will administer here, below the 4 finger width. So now we will cleanse the skin side using a cotton ball with alcohol 70% solution. So with a firm and a circular motion, starting at the center and widening the circle outward like this. And right after, allow it to dry thoroughly. And for the ninth step, inject the fluid. With the non-dominant hand, fold the skin at the side until it is filled. Hold the needle almost parallel to the skin surface, that usually 15 degrees or less, with the bevel of the skin. So with the use of this tuberculin syringe, now we will pull the skin at the site where we inject the sterile water. So like this. Pull and insert. Insert the tip of the needle far enough to place the bevel through the epidermis to the dermis. We need to stabilize the syringe and the needle and inject the medication carefully and slowly so that it is produce a small wheal on the skin. So let's do it. Right after, we draw the needle quickly at the same angle at which it was inserted. And for the 10th step, after injecting the fluid, circle the injection site with the ink to observe for redness or the induration. We will have to observe about 1 to 3 minutes to see the result. Remember, do not massage the area of the skin site where you are injected. And now, we will remove the gloves and discard all materials used properly. Right after, we need to perform the hand hygiene. The result can be given directly to the patient, and at last, document the procedures and as well as the result to the client's record.